So then, speaking of color correction, thank you so much for that segue. Here we go. Color correction. Melasma is a different animal than sun-damaged skin or dyschromia is from age. If you do not have some form of an IPL and you're a medical spa or a facial rejuvenation clinic, this is on the list of must-haves. There's a few must-haves. Remember, the must-haves, you need to treat 3 things to treat appropriately. That is back to our foundational sun-damaged skin or elemental damaged skin, skin laxity, volume loss or descent. This is how we treat elemental damaged skin or sun-damaged skin, is with light, filtered light. So we can use filters to strategically target dyschromias or discolorations in the skin. We have a few different wavelengths, but the newest Lumecca Peak on the Optimus Max, which just launched in 2024, provides us a scenario because of the way the peak power density is applied and the energies that we use. I'll spare you the science. If you need it, we can go into it. But at the end of the day, it creates an environment where this thing is way more efficient than years past or other devices. Much, much more efficient. I'll show you the level of clearance just in one treatment. So the way it's tuned creates efficiency. This is what your standard IPL should do for your patients. Look at picture left compared to picture right. It should clear sun-damaged skin. Down here is the settings, should you need them. In lighter skinned individuals, you're going to use your 515 wavelength. In darker skinned individuals, it's going to be the 580, or I use 580 for my more vascular type lesions. We have the opportunity to change short pulse, long pulse. The shorter pulse is taking the same amount of energy and cramming it into a shorter time. So it's a quick punch. That's more aggressive than a longer pulse, where we take that energy and we spread it over a longer duration. Now, we're all talking like milliseconds or microseconds, depending on what platform you're discussing. So it's still all very short, but long pulse, short pulse, that's what it means. So a longer pulse, a 580 filter is good for vascular lasers, because that longer pulse is going to bathe that tissue in that energy. Longer is going to drive it deeper into the tissue where the vessels live. Some would argue it can also create less of a bruising effect, because those short, quick, snappy pulses, you bust the vein, and they ooze, and then they bruise.